Good morning, everybody. My name is Dr. Brian Tisquejo. I'm a California licensed naturopathic doctor trained in integrative and holistic medicine. Specifically, I do a lot of gut health, hormonal health, and skin health in my office. So today is all about holistic and integrative acne. A lot of you guys submitted some questions. If you guys have any questions, feel free to comment down below. But you guys did submit a lot of questions on Instagram Live. Not Instagram Live, Instagram Story. So thank you so much for that. And I'm just meeting for this whole entire Instagram Live to just be 20 minutes. While I'm waiting for you guys to submit any further questions, I just want to do a quick recap as to why acne happens and how a naturopathic doctor like myself looks at acne from a holistic and integrative perspective. So in regards to holistic medicine, it's really like looking at the person, the patient, and their whole entire being, and really understanding how there are certain imbalances that could be causing symptoms. And in regards to skin health, we really think that skin health is a manifestation of internal health imbalances. So in regards to acne, it's going to be looking at the skin level, and then it's also going to be looking at the underlying causes of what could be causing acne, you know? So in regards to what's happening on the skin level, it's really a four-step process. So there's going to be sebum production, which is going to be basically like oil that's made in the pore. And in that pore, there's going to be a, how would you call it? It's going to be a thing called hyperkeratinization or a keratin plug. So the pore is going to be plugged with some keratin, and keratin is just basically a protein that's naturally made on the skin. So you have lots of oil being made, and then you have a keratin plug. And then as the oil is being made, it's going to cause a comedone. So it's going to slowly swell. And what a comedone is basically a blackhead or a whitehead. And a whitehead is the one that's going to be capped with a keratin plug, while there's going to be blackheads that are going to basically be oxidized oils. And then when there's enough oil in the actual pore, that's going to cause more and more swelling. But actually in that pore, there's going to be bacteria. And there's a specific type of bacteria called Propionibacterium acnes, or we'll just call it P. acnes. And Propionibacterium acnes or P. acnes is going to feed on that oil that your body is naturally making. And when it feeds on that oil, it releases inflammatory proteins. And those inflammatory proteins basically make that swelling bump turn red, and then it'll just keep on growing and growing and growing and become more and more painful. So that's when somebody really experiences like nodular or even cystic acne. Alrighty, so we just spoke about what's going on in the skin. I'm seeing some questions actually being submitted already. So let's talk about some of the underlying causes. And as you guys are submitting more questions, I'll address those questions. Like what I said, I just mean for this Instagram Live to be 20 minutes. And I'm also going to address some of the questions that were submitted on Instagram Story. So let's talk about what's like going on from within. So we spoke about what's going on the skin level, but there's some precipitating factors that's going to play a role in development of acne. So in regards to like some of the underlying causes of acne, the things that I usually see most often in practice is going to be hormones, gut health, and stress. So I posted about this on IG video, I think that's what it's called now, and I gave some evidence about like what studies have been showing in regards to the underlying causes of acne. So like what I said again, it's going to be hormones, gut, and stress. And in regards to hormones, there's going to be the main one that we think of, androgens. And androgens are going to be like testosterone. A lot of people have heard of testosterone before, but there are different types of androgens as well. So it's going to be like DHEA, DHEAS, and so much more. And to what testosterone does is that it basically activates the pore to make oil. So that's one of the steps, right? But as you have more and more testosterone, that's going to tell the skin to make more and more oil in the pores. And if the elements are right, if there's an actual keratin plug, that's going to then cause swelling. And if there's bacteria in the pore, that's going to cause inflammation and therefore acne. So we do want to look at testosterone and sebum production and what's really like triggering testosterone and sebum production. So what studies actually show is that blood sugar imbalances and insulin can play a role in testosterone and sebum production. And that's mainly seen in individuals who have PCOS. But we also see certain underlying causes of high testosterone as well, which we'll speak about in the next part, gut health. So like what I said, some of the root causes that I commonly see in office for hormonal acne or just acne in general is going to be hormones, which we spoke about already, but now gut health, and then we'll speak about stress soon. So somebody just asked how to test for hormones. I'll answer that question soon. So in regards to gut health, that really affects how hormones are going to be eliminated out of the body and also how it's detoxified in the body. So when we think of hormone detoxification, we primarily think of the organ, the liver, and the liver is located right here in the abdomen. And then whenever those detox metabolites are metabolized, it ends up in the small intestine. And once it's in the small intestine, it's going to pass through the small intestine, the large intestine, and then hopefully get eliminated out of the body. So you want to make sure that liver health is optimal. You also want to make sure that gut health is optimal. And in regards to like the intestines and gut health in general, we think of the thing called the gut microbiome, or all like the bacteria, the viruses, the parasites, etc., in the gut. And actually studies show that certain types of good bacteria, when there's too much of them, can cause hormone imbalances. It's really interesting. So we'll speak more about that soon if you guys want me to. But let's move on to stress. So stress also plays a role in acne. So when your brain perceives stress, it could be either physiological or emotional stress. And it's just always going to be stress. So when the brain perceives that, it sends a signal to a bunch of glands called the adrenal glands. And the adrenal glands are basically these glands that sit above the kidneys, and when it gets activated by the brain, it sends out two hormones. It sends out cortisol and DHEA. Remember that DHEA that I spoke about? That's going to be that hormone that's an androgen. Well, DHEA also turns into testosterone, and testosterone then turns into DHT. And all three of these work at the skin level to cause oil production and downstream acne. Alright, so we just spoke about some of the underlying causes. Somebody just asked, how do I test hormones? Can you test my hormones? Yeah, definitely. So to answer that second question, yes, I can test hormones. And in regards to testing hormones, there are a bunch of ways that hormones can be tested. So it could be done via blood, it could be done via saliva, it could also be done via urine. So in my office, I do mainly blood and urine. And in regards to blood, it's going to be like the actual hormones, testosterone, estrogen, progesterone. But you also want to understand like the brain hormones as well. So it's going to be like prolactin, LH, and FSH. And then in regards to urinary testing, I do a thing called the Dutch test. And the Dutch test is, I forget what it stands for. Alrighty, I think it stands for Dried Urinary Test for Comprehensive Hormones. I remembered. And what the Dutch test ends up showing is going to be the actual sex hormones. So it's going to be like all three types of estrogens. It's going to be the progesterone, also testosterone. And once you actually get those results, it tells you how these hormones are being made. And also tells you how the hormones, like the precursors are, and also tells you how the hormones are being detoxified out of the body. Remember how we spoke about how it's important to detoxify? That's going to be looking at liver health, but there are so many other things as well. So the Dutch test is really great at really understanding somebody's hormonal state and how that's playing a role in their acne. Alrighty, so I'm going to answer some of the other questions you guys asked, but if you guys have any other questions, feel free to comment down below. But like what I said earlier, I'm going to be answering some of the questions that were also submitted on Instagram story. I'm meaning for this Instagram live to just be 20 minutes, and I'm already 8 minutes in, but I do want to speak about how acne is addressed from a holistic and integrated perspective when you work with a naturopathic doctor. So when you work with a naturopathic doctor, it's always treating the underlying cause. And if the symptoms are really severe, it's going to be treating the symptoms in addition to treating the underlying cause. So in regards to treating the underlying causes of acne, it's going to be addressing gut health, hormonal health, and also stress. At least that's what I see a lot in my practice. And then first, in regards to addressing gut health, that's going to be there for supporting hormones. Remember how I said that the gut is really important for detoxifying, eliminating hormones? That's why you really want to work on gut health. And in regards to gut health, first of all, you really want to understand somebody's foundational health and wellness. So let's be looking at diet. And in regards to diet, there have actually been studies that show that low glycemic diets can be really helpful for insulin. Remember how we spoke about how insulin can play a role in testosterone and therefore acne? Doing a low glycemic diet kind of goes to the root cause, you know? And then there's also going to be making sure you have really adequate fiber intake. And what fiber does is going to basically help feed good bacteria. And remember how I spoke about how certain types of bacteria can increase hormone reabsorption or play a role in hormone imbalance? Well, what studies actually show is that when somebody has a high fat, low fiber diet, they have a higher level of Prevotella bacteria in their gut. And Prevotella is really important because Prevotella increases an enzyme called beta-glucuronidase. And what beta-glucuronidase does is that it basically helps increase estrogen metabolite reabsorption, and therefore higher levels of estrogens and higher levels of other hormones, which could most likely play a role in development of acne. So really like making sure you have a high fiber diet, even a low glycemic diet might be helpful. And then there's also going to be dairy as well. So dairy has been shown to play a role in development of acne. And in regards to how that happens is through insulin as well. It's really fascinating. So what studies show is that dairy can play, what dairy does is that it basically increases a hormone called insulin-like growth factor 1. And insulin-like growth factor 1 then goes to the skin and then plays a role in sebum production and acne. So those are some of the things that can be done with foundational health and wellness in regards to diet. And there's also going to be probiotics. And that's actually a question that somebody submitted. Let me see if I can get that question up. So, it said I can't put it on. So the question was actually, do probiotics help with acne and hormones? So what probiotics are going to end up doing is help reduce that Prevotella species that I spoke about. So downstream, it can help out with hormones, and downstream, it has the possibility of helping out with acne as well. So looking at probiotics may be helpful. Some individuals might not even need probiotics. So that's why it's really helpful to work with a licensed naturopathic doctor to see what's really worth your while. There are so many supplements out there, so it's really confusing, and you need some guidance at the end of the day. And there are also some liver support things that can be done as well. So there's some diet that can be done to support the liver. So making sure you have green leafy vegetables, making sure you have brassica vegetables like broccoli, cauliflower, Brussels sprouts. What is the other brassica vegetables? I can't remember. But what those basically do is help with cytochrome P450 detoxification in the liver to help with detoxification. And then there's also going to be some herbs and antioxidants as well that are also going to be really helpful for supporting liver function and helping out with hormone detoxification and gut health at the end of the day. And okay, so we spoke about gut health and how that plays a role in hormones. How about stress? So what we know about stress is that it increases DHEA, and DHEA has the possibility of turning into testosterone, and testosterone can turn to DHT, and all three of those can go on the skin and cause oil production and downstream acne. Alrighty, so what can we do in regards to stress and adrenal function? Remember how I spoke about how the adrenals are the ones that are going to be activated? So you really want to support the adrenal glands. And there are some lifestyle and dietary things that can be done from the get-go. In regards to lifestyle, I'm actually posting about this soon. So what studies show is that mindful yoga can help reduce testosterone levels. So that's really cool and awesome. And then in regards to lifestyle, it's also looking at exercise. So you don't want to do exercise that makes you feel crappy afterwards. You want to make sure you do exercise that makes you feel energized afterwards. If it makes you feel crappy, ill, and tired, like this form of exercise, that's telling us that this form of exercise, most likely is going to be too much on your body. But at the end of the day, everybody's different, and that's why it's really helpful to work with a licensed provider to see what's worth your while. So you want to do exercise that's going to be very kind to the body, but very energizing at the same time. And like what I said, everybody's different. So we spoke about yoga, we spoke about exercise, and then there's also going to be diet as well. So remember how I spoke about how stress can either be physiological or emotional? So with diet, there's going to be a lot of physiological stress sometimes. So some individuals can experience a thing called hypoglycemia, which is basically medical terms for low blood sugar. And when somebody experiences low blood sugar, that is a stressor on the body, and the adrenals go active and then could possibly lead to like downstream acne. Through the hormones and everything that I spoke about. So you do want to make sure you have steady blood sugar throughout the day. And the way you really do that is by making sure you have a complex carbohydrate with a protein at every meal as best as you can. And what complex carbohydrates are going to be, some examples are that oatmeal, flax seeds, chia seeds, brassica vegetables, sweet potatoes, basically any crunchy that is not white rice, that is not pastries, not bread, and no sweets. And in regards to proteins, any protein source that you prefer. So those are some dietary and lifestyle things that can be done to support adrenal function, and therefore support hormone balance, and therefore support somebody's skin health when they do experience acne. And there's also going to be some like minerals and vitamins that can be adrenal supportive, but again, make sure you work with a provider before trying anything new. So in regards to some minerals, there's going to be magnesium. What magnesium is going to do is basically help increase GABA in the brain. And what GABA basically does in the brain is that it helps calm the body. And you want to make sure you calm the body. That's really important. It's also really helpful for sleep. And I actually forgot about that. You want to make sure you're sleeping well. Because if you're not sleeping well, you're going to wake up tired. And as you're really pushing yourself throughout the day with that fatigue, that's going to be a stressor on the body. So you want to make sure you're sleeping well. So magnesium not only is it really good for relaxation, it's really good for sleep. And then in regards to vitamins, it's going to be like vitamin C. There's also going to be vitamin B5 and all these things that have been shown to be really supportive for the adrenal glands itself. And then there's also herbs that might be prescribed by a licensed naturopathic doctor, depending upon what the patient is presenting. So there's going to be two classes of adrenal supporting herbs that we think of. There's going to be adaptogens and nervines. So what adaptogens are basically a class of herbs that help calm the body. Not really calm the body. It's going to help the body adapt to stress. That's why they're called adaptogens. So we have energizing adaptogens, we have calming adaptogens. And like what I said, you do want to work with a provider before really trying anything new, because some of these might actually not be safe for some individuals. And then in regards to nervines, which is the second class that some licensed NDs might recommend, they're going to be actual herbs that calm the mind and calm the nervous system. And like what I said, that might be really important for some individuals. Alrighty, so in regards to all these things, it's going to be really supporting the adrenal glands, really optimizing somebody's stress response to help reduce the levels of DHEA, testosterone, and DHT. And by really optimizing those three androgens, it's going to help with somebody's skin process, because like what we said earlier, hormones are one of the mitigating factors that cause acne at the skin level. But we've been speaking about these underlying causes, and hopefully it's been really interesting. And then there's all going to be some direct skin support as well for some individuals when acne is too severe. Doing actual treatments on the skin or more skin-directed treatments are going to be more helpful. So in regards to that, it's going to be really looking at somebody's skincare routine, really understanding if they have comedogenic products, and really replacing those products with non-comedogenic facial products. And it's also going to be using skincare products that going to really target sebum production or oil production. It's going to target hyperkeratinization, or that keratin plug that I spoke about, targeting bacteria, or even targeting the inflammation caused by that bacteria that's playing a role in the acne that I spoke about. And then in regards to oral and topical pharmaceuticals, there are so many of them. So they're going to be like oral antibiotics. There's going to be hormonal birth control. And somebody actually asked about hormonal birth control. And then there's also going to be spironolactone. There's also going to be retinoids or topical or oral retinoids. And then in regards to topicals, there's going to be topical antibiotics. There's going to be topical benzoyl peroxide, and then also topical retinoids as well. And all of this mainly works at the skin level if somebody, and like what I said, if somebody has really severe acne, working at the skin level and working with underlying causes will be most helpful. Alrighty, so let's answer some of the questions you guys submitted. And somebody asked about hormone testing, already answered that. Somebody asked about probiotics, already answered that. And then the second question that I see is going to be, is hormonal birth control the only option? This was submitted on Instagram story. And honestly, like what I said today, hormonal birth control is not the only option. There are a lot of other oral and topical pharmaceuticals, and there's also going to be root cause treatment that can be done. And in regards to root cause treatment, there's going to be a lot of naturopathic, integrative, and holistic options that we spoke about today. So really depending upon what the underlying cause is in regards to your personal acne process, you have some integrative options that include diet, lifestyle, target supplementation with vitamins and minerals, or also some herbs that are also really helpful. And then also looking at somebody's skincare routine is going to be really helpful as well. And then somebody also asked, what's better, topical treatments or supplements? So at the end of the day, like what I said earlier, really depending upon somebody's severity of acne, doing topical treatments might be more helpful, doing oral treatments might be more helpful. So for individuals with moderate to mild acne, I've seen it be really helpful to treat from within and then just do like spot treatments. And then in regards to more severe acne, doing more topical or skin directed treatments are going to be more helpful while we do underlying treatments. Because if we just do these skin directed treatments and not really address the underlying root cause, what happens when you really discontinue those skin directed treatments? acne comes back. So you want to make sure that the root cause is treated, and so that when you get off of these pharmaceuticals that are skin directed, you don't experience acne afterwards. And most of the time, people can experience acne after discontinuing pharmaceutical treatment because they have not addressed the underlying cause. So get to the root cause. And then let's see. Somebody said, I see some influencers say milk thistle and dandelion help. How does it help with acne? Yeah, definitely. So in regards to milk thistle and dandelion, specifically dandelion root, that's going to work at the liver. And like what I said earlier, working with the liver really helps with skin health by really promoting detox pathways. And just a quick recap, or going back to that part, just want to make sure you have a really good diet first before really adding on these herbs. So you want to make sure that you have those brassica vegetables. You want to make sure you have those antioxidants from your diet, and so much more. And then let's see. Somebody asked about I have PCOS. I came off birth control in 2020 and my skin hasn't cleared. What do you suggest? Yeah, definitely. So I don't mean for this to be a space for personal medical advice. So I wanted to speak about this from a general perspective. So in regards to this question, birth control is going to be one of the treatments for PCOS. What birth control is going to basically do is help balance the hormones. And what we know about PCOS is that it's this metabolic endocrine disruption that leads to symptoms of cystic acne, facial hair growth, body hair growth, head hair loss, infertility, and irregular cycles. So infertility in some individuals, not always, but it definitely leads to irregular cycles. And like what I said, what hormonal birth control is going to basically do is help balance out hormones to reduce these symptoms. But some of the root causes of PCOS is going to be diet, honestly, or blood sugar levels. So you really want to optimize somebody's blood sugar levels as a licensed naturopathic doctor. So it's going to be looking at their diet, it's going to be looking at their insulin sensitivity, it's going to be looking at also their stress response and adrenal function. Because what I've been seeing in office is that when somebody has high levels of stress, that affects their blood sugar levels. And I've seen that on continuous glucose monitors, which is really interesting. So we really want to support insulin sensitivity to help reduce the symptoms of PCOS. And I've actually been doing a whole entire series on PCOS on my Instagram reel. And recently I've been speaking a lot about diet and lifestyle to help support insulin sensitivity for PCOS. So if you're still experiencing symptoms of PCOS after discontinuing hormonal birth control, try to get to the root cause and work with the licensed provider to see what's worth your while and what's the specific root cause for your personal health and wellness. And then let's see. So I answered all of the questions on Instagram story, and it seems like I answered most of the questions that were submitted. I see one that somebody asked what form of magnesium is the best? Yeah, so in regards to the magnesium that I spoke about, that's going to work on the, with GABA, it's going to be magnesium glycinate. But before you really try magnesium glycinate, make sure you work with a provider to see if that's worth your while, because there's so many different types of magnesiums. So the reason why magnesium glycinate might be helpful for some individuals, is that magnesium helps with helps with GABA, but glycine also helps with sleep. So the combination of two is more effective for sleep. But let's say like somebody experiences constipation, there's going to be different types of magnesiums for that. So it's like magnesium oxide, magnesium citrate. And in regards to those two, a provider might really like tailor which magnesium to really recommend, while at the same time supporting relaxation in the body. And then if you guys have any other questions, feel free to comment down below. Somebody just asked, in other words, if somebody wants to work with you but isn't located near you, can they still work with you? So I only see patients in person, unfortunately, just because I'm only licensed in the state of California. But I do know that my colleague, what's her name? Dr. Megan Holpuck, can see clients outside of her state. So check her out, Dr. Megan Holpuck. And she's also really good with acne and pediatrics. And Yasmin Trejo, acne in teenagers, so that's acne in pediatrics. Dr. Megan Holpuck will be really helpful for that. And in regards to teenage acne, people can experience acne as a teenager because of just honestly high levels of testosterone, but could also be due to like diet as well. So teenagers naturally have a peak in testosterone as they're going through puberty. But then like if somebody has like extra things that are causing higher levels of testosterone, it's really addressing those extra things. So those extra things are going to be like diet, it's going to be insulin sensitivity, it's going to be stress response, it's going to be so many other things, you know? So really like understanding somebody's extra or underlying causes is going to be really helpful, especially when they experience acne as a teenager. But do know that acne as a teenager can happen because of just natural peaks in testosterone. And like what I said, there might be some underlying causes that's just causing extra testosterone that's manifesting as acne. So at the end of the day, work with a provider. Alrighty guys, so this Instagram live started at 6:30. I just meant for it to be 20 minutes and I'm 5 minutes over. If you guys found this helpful, let me know on Twitter. Give me some feedback on Twitter, please. Follow me on Twitter and tag me in the comments. Tell me what you found most interesting, what I need to work on in the future. If you guys have any other follow-up questions, ask me on Twitter. Alrighty guys, I am out of here. I hope you guys really enjoyed this Instagram live. Hopefully it wasn't too boring, but I had an awesome and fun time with you guys. Alrighty, adios.